I started my career as an MSL. I did so in a top 5 pharma company, 80,000 employees globally, very large organization, very wide triangle of leadership, as you can imagine. In a large organization, communication is done so by the leads of all the different functional roles. So the regional director would have communication back and forth with the national liaison lead, who would then talk to the vice president, who would get their overarching strategic imperatives and aims from the senior vice president, who essentially rolls up into the CMO. And that sort of that smooth coordination there is done in a large company because you have information flowing largely in one direction. In a small company, and I hate to use these industry tropes, but in a small company, you truly are building a plane while you fly it. I think I'm employee 300 and something at a relatively small biotech that's owned by a much larger parent organization, but this biotech is allowed to operate relatively independently as in an oncology expertise area. And so I found that in a smaller company, the communication not just is, but absolutely must be back two-way and must span the entire gamut from CEO down to field medical employee. This level of communication sounds like chaos, and I think to the untrained eye actually is. But much like early cavemen spoke in paintings on a wall, we speak through PowerPoint. And so I will develop slides that as clear as I can be, clearly lay out, here's where we want to be, standing in the result. This is what I would like to implement in 6 months. And then I'll take my next slide will be, here's where we are today.